Obstetrics and Gynaecology. Yes, got it. And she'll be telling us a little bit about it. I'm just realizing that I don't think I've gotten my shot yet. I've done a pap smear, but I haven't gotten my shot yet. Am I late? Is this like I need to figure it out? Honestly, I'm happy to have this conversation with you. But for a lot of people that don't know what it is, what is cervical cancer?
Okay. Cervical cancer is cancer of the cervix. Now, I don't think people know some people may not know what the cervix is.
Right.
So as a woman, you have a uterus, which is your womb. And then when you are coming out into the vagina, the end of the womb or the mouth of the womb is what we call the cervix. And that part of the body or that part of the uterus or your womb can have cancer. And then we call it cervical cancer.
Okay.
Yeah.
All right. Now, how does it develop?
Now, cervical cancer is a cancer that is caused, about 95% of cases, is caused by an infection, a persistent infection with a virus called the human papilloma virus.
Okay.
So when you're infected with that virus and your body is not able to clear it out, you're infected with the dirty or the evil strains of that virus, your body is not able to clear it out and it's in you for a very long time. It goes to change the cells in the cervix. The cells start to multiply and divide and act very abnormally and then progress to what we know as cancer. So that is basically what it is.
Okay, so what is HPV or the human papilloma virus?
Yes, so it's a virus, like how we have the flu virus, all of those things. But this one is the human papilloma virus.
Okay.
And it's a virus that is gotten from sexual intercourse. So almost every sexually active woman in her lifetime will be infected with this virus. But then your body has the ability, in about 90% of cases, the body is able to get rid of this virus. But then when the body is not able to get rid of it and it stays for a long time, and you have the highly oncogenic strains or the strains that can cause cancer, you have these ones in your body for a long time, your body doesn't clear it, then it can lead to cancer.
Okay. What are the symptoms of cervical cancer?
There are symptoms, but just like a lot of cancers, once you start experiencing certain symptoms, then we are getting too late. So truly, in the beginning stages, or when it's not yet cancer, you may not experience anything. When there are just abnormal changes in the cells, you won't experience anything. Even the early stages of the cancer, you may not experience anything. But later on, as it progresses, you may see that you are having some unusual bleeding. You are menopausal. You had your last period 2 years ago, but all of a sudden you're bleeding again. Now, even in between your periods, as a woman who is still having periods, in between your periods, you are bleeding. After sex, you're bleeding and you're having some pelvic pain after sex or some unusual discharge that you may not like the smell of. And when it progresses to a certain extent or the cancer even spreads, then weight loss, you feeling weak. If it goes to compress on the bowel and then the bladder, then you have the urinary symptoms, constipation, those things. But at that time, you've gotten fat. So the beginning is at the beginning you may not notice anything, but as it progresses, then you have these bleeding changes, pressure changes, and things like that. Yeah.
Okay. Now, are there habits that can increase your risk of getting cervical cancer?
All right, we don't like to say habits, but what we can say is that there are certain things that make you more at risk. So yes, truly there are some habits, like smoking. Smoking reduces your immunity.
Okay.
So if we are saying that your body can fight against it, it means that you have to help your body, right? So if you're smoking, your body cannot fight against it appropriately, so that's a higher risk. Those who unfortunately are immunocompromised, like those with diabetes, HIV, other cancers and things on medication that suppress the immune system, they are at risk as well. Now, if you have multiple sexual partners, you know that I said it's a virus that you get through yes, so if you have multiple sexual partners, or if you have one sexual partner who has multiple sexual partners, exactly, or if you start having sex at a very young age, the probability of having multiple sexual partners and all of that is there. So we say that is one. And then if you're of low socioeconomic status, so that doesn't mean that a poor person, but let's take our country. In certain countries, they have vaccination protocols from time immemorial, so almost all their ladies are vaccinated. But in a low socioeconomic country, like in sub-Saharan Africa, like in our environment, a lot of people are not vaccinated, a lot of people don't get screened, so it increases the risk because we don't detect it early, we don't protect ourselves from it and things like that. So these are some of the things that predispose or increase the risk.
All right. Okay. Now, prevention, because it's a very preventable and cancer. So how can you prevent it?
Prevention vaccination. Last year, I don't know if you remember, but there was a nationwide vaccination of girls.
Yes.
That's such a great initiative. So that is what you have to do to prevent. But if you're older than 9 to 14 years, up to 26 years, you can vaccinate. You walk into the hospital, you let them examine you, you just vaccinate up to 26 years. But after 26 years, up to 45 years, it's a decision between you and your doctor.
Okay.
So you go, if he suggests that, okay, get screened, and if everything is fine, we vaccinate, that becomes a decision. But under 26 years, especially 9 to 14, when we know that they haven't had sex before, that is the prevention.
Okay.
But if you're not able to do that, or you've passed the age of that, then screening, because there are stages, and even before you get to cancer, there is a point where your cells may be acting abnormally, but it's not yet cancer. So when we screen and we detect, we're able to do something about it there and then you go on and cancer doesn't happen. And even in the early stages of cancer, this cancer is very treatable. So these are the things that we are encouraging everybody to do.
Okay.
Vaccinate and screen.
So what are the recommended guidelines for screening?
The recommended guidelines for screening, internationally, when you're 21, you get a text message on your phone. Have your first pap smear. Yes. But then, any woman above 30 years, we recommend that you do both the pap smear and the HPV DNA, meaning that they'll scrape just a bit and look at the cells under the microscope to see if the cells are fine. And they'll also check if this HPV infection, you have it. So after 30, it's recommended. If they do just the pap smear, that is just looking at the cells, and you do not have any abnormal cells, they'll tell you in 3 years, come and repeat. If they check both the cells and if you have HPV, and they say everything is fine, so that is the HPV pap co-testing, they'll tell you in 5 years, come. So it's more expensive to do the two, but then when you do it, it's a longer duration for which you come. So every woman, 3 years if it's pap smear, 5 years if it's the HPV pap co-testing. So I'm advising you as well.
At this point in time, I definitely need to take on that. Okay. When you say expensive, give me a range.
For the vaccination or the screening?
For both.
All right, the vaccination, girls 9 to 14, last year,
it's free.
It's free. And I think when you still walk into district hospitals, they can be vaccinated. Other than that, vaccines can range from 1,500 to 3,000 cedis for a shot.
Okay.
And for the average Ghanaian, that is expensive.
Yeah.
However, for screening, if you're doing just the pap smear, about even 100 cedis or 150 to 200 cedis, you can do that. Okay. And if you're doing the combined test, the co-testing, then about 500 cedis.
Okay, all right.
But I mean, if you pay 500 cedis and in 5 years you
don't come back again, that's a good trade-off. Yeah. All right. Is it as easy to walk in, okay, as a lady above 30 like myself, to say, okay, I want the peace of mind of knowing that I have a shot? Is this something that is recommended?
For the vaccine?
Yes, for the vaccine.
For the vaccine. Yes, you can walk into any health facility, a lady above 30, speak to your healthcare provider, and then you make a shared decision. He may say that, okay, let's do the testing first, and if there is nothing, you take the vaccine to protect yourself. If there is something, we sort it out, and after that, we may vaccinate you. So above 30 or above 26, that is how we go about it. Okay. So 45 years.
Okay, I like that. Now, if you're just tuning in, Cervical Cancer Awareness Month is the month of January. If you're a lady who's never had a pap smear, you've never had your vaccine, then it's time for that to change. It's a very preventable disease. It's something that with the right vaccination, with following the right protocols, you don't have to waste your time thinking about it or waste sleep worrying about it. It's something that is very preventable. So we're encouraging everyone to know what it is, and most importantly, to get ready to either vaccinate, do a pap smear, do a combo pap smear and HPV DNA test, and find ways in which you can be rest assured that it's something that will not keep you up at night. Now, is there a difference between a pap smear and an HPV test?
Yes. So the pap smear, let me take you through the procedure.
Please.
You go and you see the healthcare practitioner. They make you comfortable on the examination chair. They pass a speculum gently, and then they open up and they use a small brush to just take a bit of a sample, and then they look at it under the microscope, and then they let you know that, okay, the cells were fine, the cells were like this, the cells were like that, let's do this and that. The HPV pap co-testing, for that they do the pap as well, but then they check if this virus that we are talking about, you have it. So the cells may be fine, but you may have this virus. the virus that we said can lead to cervical cancer. So when we detect that the cells are fine, but you have this virus, then we know that we have to be screening you more frequently, and then you have to be eating well, taking care of yourself also, that your body can clear it. Yes, then we'll be monitoring to make sure that everything is fine. So that is the difference. One checks just the cells, and one checks the cells plus the virus that causes this cancer.
Okay, all right. Now, survival rates. When you go through both testing, if you get the vaccine, how prevalent is it in Ghana at this point?
All right, so in my reading, I discovered that worldwide is the 4th commonest cancer affecting women.
Wow.
But in Ghana, it's the 2nd.
Wow.
Because in countries like the Swedish countries, Denmark, and even the United Kingdom, we are coming to a place where cervical cancer is not a problem. Because when you're 9, your mother will get a message to go and vaccinate you. So they have been vaccinating for years, and they are on the path of elimination. But we have just started. So it's very common here. Breast cancer, of course, is the commonest. We know so much about it. But cervical cancer is also there, and it's also doing a lot of harm. And when it gets to the late stages, it's very difficult to manage. And then you just have to help the person to have a peaceful death. But it's something that can easily be prevented. In some countries, they are not even recording cases. So we can do a lot about it.
Absolutely. Now, for some people, when they hear screening, they get very agitated or very scared. How do we calm people that instantly get very hesitant to get screened or to get vaccinated?
Now, people's things are okay, let me take the vaccine. A lot of people had some hesitancy about the vaccine because they believed that it will cause some reproductive issues to their children, but that is not so. In the countries that have had these vaccination schedules for a long time, they are reproducing. If they don't, they are choosing not to give birth, but they are reproducing. Everything is fine, and it's tested and tried over years. So that fear is not valid. When it comes to the screening too, you know that there's a Ghanaian adage that what you don't know will not kill you.
That's true.
So people don't want to know.
Go and check,
but
yes.
in the end, you will end up knowing. If it's there, you will end up knowing. Your body will show the signs, and it may be too late. So it's better to know it early and do something about it. And as I said, the body eliminates the virus in 90% of the cases. So when you check, you may even discover that you are fine. Secondly, some people say that the screening procedure, they think will be difficult. I don't think it's a painful procedure. It can be uncomfortable when they pass the speculum down there. Yes, it can be uncomfortable, but it's once in 5 years or once in 3 years. And then you would have the peace of mind that you are okay. So I think it's worth it. It's worth it to do.
I think so. All right. So are there any big plans in the month of January? Are different healthcare providers providing certain amenities? Is it easy to just walk in? Are there places that we should target to walk to be able to get some more information, screenings or vaccinations?
Yes. So the places I work, the CPF Medical Units, Greater Accra Regional Hospital, you can walk in to get the pap smear done easily. And then I know that any government facility near you, you can also walk in, go to their reproductive or family planning units. Usually the family planning units, you go there and then you get it done. And it's a very simple procedure. You can just walk in.
Okay.
Please, I want to vaccinate about cervical cancer. I want to get screened. And they'll be more than happy. And I know that during this month, I know Rotary Ghana is doing a project. They are going all around the country doing some screening as well.
That's amazing.
So
yeah, okay. That's amazing. So it's something that all women, regardless of your age, should be considering. If you've gone beyond a point where vaccination is not necessarily on top of mind, at least you can be able to screen and ensure that every few years you are on top of it. The least we can do is ensuring that something as preventable as cervical cancer does not catch us unawares. So I'm very excited about that. I'm definitely going to be scheduling. In fact, this afternoon, Saf, I think this is a wake up call for me. So
I will take
this afternoon, I think I want to follow through and then get it sorted out. But in terms of nutrition, what we should be eating, what we should be looking out for to either maybe not prevent, but manage people who are at risk of cervical cancer. What kinds of meals should we focus on?
All right, so this question is very broad, but I would say it this way, that we said that the body can clear the virus. So you have to be focused on things that build your immune system and do away with things that we all know bring down the immune system. So do away with smoking, do away with drinking excess alcohol, a sedentary life, like just sitting down all the time, not taking walks, exercise, all those things, do away with them. And in eating, mostly foods that are very rich in antioxidants. So a lot of fruits, for everything, a lot of fruits, a lot of vegetables, cutting down on the fatty foods and then the processed foods and things like that. Especially with those that when they get their reports, they see that they have the HPV virus. The body can clear it, but you have to be very intentional in building your body, taking your vitamins, eating well, eating rich. Rich doesn't mean oil and fatty things, but eating very well. And if you're smoking, know that you're doing yourself a disservice. If you're taking excess alcohol, it won't be good. Trying to exercise a lot. And interestingly, things like bleaching creams and the rest, they also bring down immunity. So if you're doing things like that, then you stay away from anything that can disturb your immune system and focus on things that can build it up. And hopefully, your body would be able to clear it.
I love that. So these are some very, very salient points that we should all be making note of and doing our best to work on. But so going to all public hospitals, the Greater Accra Regional Hospital, and other healthcare facilities will give us access to all the treatment options and the screening options that are available. Now, final words from you on why we should all be paying particular attention. If the men are listening to their women, if the women are listening to your sisters, your cousins, your aunts, your mothers, why should we be, in this month especially, be extra careful and raise more awareness for cervical cancer?
Yes, I would say that I have seen cases, end-stage cases of cervical cancer. I have even seen deaths from cervical cancer. And it is very needless. It's something that we can prevent entirely or we can treat very early. So please, you're your first doctor. Your life is in your hands. Get vaccinated. And if you can't get vaccinated, make sure that you stick to a screening schedule. It's expensive, but there's nothing more expensive than your life.
Absolutely.
So take care of yourself, and then we'll all live a happy, healthy life. Because women are the unit of the country, the unit of the family, everything. So we have to take care of ourselves. Yeah.
Now, I'm sure breaking the news to any patient is very, very difficult. Is there one that stands out to you about letting them know or breaking the news to them that they may have cervical cancer? That you can remember.
Breaking the news about cancer is always difficult. But one case I've seen that I remember is after telling her all these things, of course, she was very sad because when you hear cancer, you think it's death. But she went to read a bit, and I think she told some of her children. And then they saw that HPV is from sexual intercourse, and then the shame, as though she's lived a certain life.
Oh, wow.
To get that. So I would like to say that cervical cancer or being infected with HPV, it doesn't mean that the person has lived a promiscuous life or they've done anything negative. Almost every woman at a point in her lifetime will be sexually active. And we are saying that majority of women in their lifetime will contract this virus, but the body can clear it. So the fact that someone's body has cleared it, or someone screened and vaccinated and someone didn't, it doesn't mean that that person lived a promiscuous life, did anything negative. So I think that's a message we want to carry across, because she took the message and she was very sad. But Lisa, what even broke her further was her children asking her these kind of questions that, so does it mean you did this? Does it mean you did that? One ball pray and things like that. So that's a message I'd like to send across. It's not a condition or a cancer that is related to promiscuity. It could be anybody at all.
I like that.
Yeah.
All right.
I want you, baby.
So let's be kinder when we hear these particular issues and put a human face to it. It doesn't mean they were promiscuous.
I need you.
Doc, thank you so much for coming through. Always a pleasure having you here. Today, I'll follow up with it. Me myself, this is a wake-up call for me, so I'm going to wake up. I'm going to follow up with it and book my next screening. I've done it before, and I think that's maybe what made me feel very comfortable. I was like, oh, okay, I've done it, so I don't need to. I should have followed through with a vaccine so I could sleep better, but I'm going to do that now. Dr. Ntiamoah, an obstetrician and gynecologist at OBGYN in. Thank you so much for coming through, Dr. Erica. Always a pleasure. Gonna get back into more great music right here on 3 Lounge.
I guess I didn't try hard enough, but we could work this like a 9 to 5.